Hi everyone, welcome back to my YouTube channel. Today's presentation is on that participation continues to grow in CMS's Accountable Care Organization initiatives in 2024. Let's get started. On January 29, 2024, the Centers for Medicare and Medicaid Services or CMS announced increased participation in CMS's Accountable Care Organization or ACO initiatives in 2024, which will increase the quality of care for more people with Medicare. Of note, CMS is announcing that 19 newly formed Accountable Care Organizations or ACOs in the Medicare Shared Savings Program are participating in a new permanent payment option beginning in 2024 that is enabling these ACOs to receive more than $20 million in advance investment payments or AIPs for caring for underserved populations. An additional 50 ACOs are new to the program in 2024 and 71 ACOs renewed their participation, bringing the total to 480 ACOs now participating in the Shared Savings Program, the largest ACO program in the country. CMS also announced that 245 organizations are continuing their participation in two CMS Innovation Center models, ACO Realizing Equity, Access, and Community Health or ACO REACH and the Kidney Care Choices or KCC models. Quote, one of CMS's top priorities is to expand access to quality, affordable health coverage and care, said CMS Administrator Chiquita Brooks LaShore. Another quote, accountable care initiatives which give more tools to healthcare providers to deliver better care and help people receive more coordinated care through programs like the Medicare Shared Savings Program and the Innovation Center Accountable Care initiatives are critical to achieving this vision. Accountable care organizations are groups of doctors, hospitals, and other healthcare professionals that work together to give patients high quality, coordinated service and healthcare, improve health outcomes, and manage costs. ACOs receiving AIPs are required to invest in healthcare infrastructure, staffing, and providing accountable care for underserved beneficiaries. These 19 new ACOs are hiring community health workers, utilizing health assessment and screening tools, and implementing quality improvement activities such as case management systems, patient registries, and electronic quality reporting. In 2024, three innovative ACO initiatives continue to grow, enabling higher quality care for people with traditional Medicare, the Shared Savings Program, the Permanent ACO Program, the ACO REACH model, which intends to increase access to and improve care for underserved populations, including those in rural areas, and the Kidney Care Choices model, which focuses on coordinating care for people with Medicare, with chronic kidney disease and end stage renal disease so more people can live fuller and longer lives. Overall, in 2024, there are about 13.7 million people with traditional Medicare aligned to an ACO. ACOs are now serving nearly half of the people with traditional Medicare, which is a 3% increase since 2023. This growth in ACOs is important since ACOs have been shown to have superior quality performance compared to similar physician groups not participating in an ACO, and ACOs have generated year-over-year savings for the Medicare Trust Fund. In the 2023 Physician Fee Schedule Final Rule, CMS took several actions in the Shared Savings Program to better align value-based programs, drive growth in accountable care, and create a more equitable healthcare system, including scaling components from an innovation center model test that was shown to produce savings and maintain quality in the Medicare program writ large. After CMS observed that the ACO investment model drove increased ACO participation in rural and underserved areas, and saved dollars for the Medicare trust funds, CMS incorporated the most important elements into the shared savings program as AIPs. Already in the first year of implementation, CMS is seeing increased participation among healthcare providers from rural and underserved areas, just like in the model test, yet another example of the value that the Innovation Center brings to CMS and the public. These actions build on parts of previous ACO model tests, such as the Pioneer ACO model and the Medicare ACO Track 1 Plus model, that have already been incorporated into the shared savings program by informing the development of the higher risk tracks, which are selected by 65% of ACOs in the shared savings program today. As a result, for 2024, the shared savings program has 480 ACOs with 634,657 healthcare providers and organizations providing care to over 10.8 million people with traditional Medicare. With the addition of the ACOs receiving AIPs or advance investment payments, ACOs are delivering care to people with traditional Medicare in 9,032 federally qualified health centers, rural health clinics, and critical access hospitals, which is an increase of 27% from 2023. Quote, the new advance investment payments will enable healthcare providers in rural and other underserved areas to build the staffing, infrastructure, and care delivery improvements they need to succeed as ACOs, providing high quality, equitable, accountable care to their communities, said Meena Seshamani, MD, PhD, Deputy Administrator and Director of the Center for Medicare. Another quote, everyone deserves access to the type of whole person care delivered by ACOs. For 2024, the ACO REACH model has 122 ACOs with 173,004 healthcare providers and organizations providing care to an estimated 2.6 million people with traditional Medicare. This model has 1,042 federally qualified health centers, rural health clinics, and critical access hospitals participating in 2024, which is more than a 25% increase from 2023. Increasing the number and reach of ACOs in underserved communities will help close racial and ethnic disparities that have been identified among people with traditional Medicare in accountable care relationships. For 2024, the KCC model or the Kidney Care Choices model includes 123 kidney contracting entities or KCEs and CMS Kidney Care First or KCF practices, which are accountable for the quality and care of their aligned people with Medicare. The KCC or Kidney Care Choices model has more than 9,227 participating healthcare providers and organizations, which is a 10% increase from 2023, serving 282,335 people with Medicare who have chronic kidney disease and end-stage renal disease in 2024. Quote, the strong participation in our accountable care models in 2024 will help more people access high quality, coordinated health care that will improve their quality of life, said CMS Deputy Administrator and Innovation Center Director Liz Fowler. Another quote, the ACO REACH and KCC models are a cornerstone of our strategy to transform the healthcare system, focus on equity in everything we do, and deliver person-centered care that meets people where they are. With the reference slide, I end my presentation here. If you found this information useful, please consider subscribing to my channel. Thank you for watching. Bye now.